El sábado pasado yo fui a una protesta en frente del hospital de Wyckoff Heights en Brooklyn. Los manifestantes de Occupy Wall Street estaban allí para llamar la atención sobre la posibilidad que el hospital de Wyckoff Heights podría cerrar. Los manifestantes dijeron que no es aceptable que el alcalde, el Blumbito, hiciera reducciones financieras a los programas de la salud y a los hospitales de la ciudad de Nueva York. Te voy a enseñar lo que pasó durante la protesta.
We need hospitals.
We need hospitals.
Where they are needed.
Where they are needed.
Not where they are profitable.
Not where they are profitable.
A hospital that serves.
A hospital that serves.
Poor people.
Poor people.
Will be poor.
Will be poor.
Under our current system.
Under our current system.
We need to change that system.
We need to change that system.
So I want to introduce some speakers.
We're going to talk about what's happening
Here at Wyckoff.
here at Wyckoff.
This is Elisa.
From the Save Our Safety Net campaign.
From the Save Our Safety Net campaign.
Right.
Everybody.
Right.
I'm Martin.
Here.
I'm from an organization called the Save Our Safety Net campaign.
Called the Save Our Safety Net campaign.
We're a coalition of community.
We're a coalition of community,
labor, and advocacy groups. Working to protect
the
healthcare safety net in New York.
the healthcare safety net in New York.
Safety net hospitals.
Safety net hospitals.
Are hospitals like Wyckoff.
Are hospitals like Wyckoff.
That serve a majority.
Of
people on Medicaid.
Of people on Medicaid.
And the uninsured.
And the uninsured.
In New York.
In New York.
This means communities of color. Low-income communities.
Low-income communities.
And immigrant communities. A couple of months ago, the governor decided that a group of five people were going to decide the fate of Brooklyn hospitals. The leader of this group is a man named Stephen Berger. He's an investment banker. He's a millionaire. He lives in the Upper East Side. But he doesn't know anything about our communities. He knows about profit. And he knows about turning hospitals into institutions that make money. And leave communities behind. This committee of five people had no community representatives. Had no transparency. And made all their decisions in private. They recommended that five hospitals be merged into three. This means a loss of 1,200 hospital beds. In North and Central Brooklyn. Right now, Wyckoff is on life support. And we're here to say that Wall Street should not decide who gets health care in Brooklyn. The people should decide their own health care system. One that works for them. One that supports the local community. One that offers culturally competent care. And one that will work for Bushwick. This year, he wants to eliminate our Office of Minority Health. And the State Department of Health says that the district public offices will take responsibility.
That the district public offices will take responsibility.
But what he neglected to mention mention
But he neglected to mention
that there are no district public offices
that there are no district public offices
in Staten Island or Queens.
in Staten Island or Queens.
Another cut is the $5 million cut to child health clinics.
Is a $5 million cut to child health clinics.
$2 million
$2 million
for rapid HIV testing.
for rapid HIV testing. Elimination
Of the sexual assault response team.
of the sexual assault response team.
And $2.5 million to our infant mortality reduction initiative.
And $2.5 million to our infant mortality reduction initiative.
$1.5 million.
$1.5 million
Mental health cuts.
mental health cuts.
$1.25 million.
$1.25
For
million
Children Under 5 mental health initiative.
for our Children Under 5 mental health initiative.
Should I go on about these cuts that we don't know about? And should I go on about these cuts that we don't know about? Millions and millions are being cut from our communities.
Millions and millions are being cut from our communities
Every year.
every year.
And we need to say no.
We need to say no.
My name
My name
is Matthew.
is Matthew.
I have worked here
I have worked here
since last July.
since last July.
I give anesthesia,
I give anesthesia,
and I try to wake everyone up too.
and I try to wake everyone up too.
And we need to all wake up
And we need to all wake up
and realize what's going on.
and realize what's going on.
Morgan lost $2 billion.
Morgan lost $2 billion.
The government will bail them out.
The government will bail them out.
Who bails out the hospital?
Who bails out the hospitals?
We need this hospital.
We need this hospital.
It's a good hospital and we care.
It's a good hospital and we care.
We are here today
We are here today
as part of Occupy Wall Street.
as part of Occupy Wall Street's
Week of action
week of action
against city budget cuts.
against city budget cuts.
We need hospitals
We need hospitals
where they are needed.
where they are needed,
Not where they are profitable.
not where they are profitable.
A hospital that serves
A hospital that serves
poor people
poor people
will be poor
will be poor
under our current system.
under our current system.
We need to change that system.
We need to change that system.
We need hospitals.
We need hospitals
and healthcare.
and healthcare
for everyone.
for everyone.
That's your
Human
human right.
right.
Demand it.
Demand it.
Uno de los problemas que tienen los hospitales, los que están en peligro de cerrar, como el hospital de Wyckoff Heights en Brooklyn, es que nuestro sistema de salud que existe hoy no paga a todos los hospitales de la misma cantidad de dinero para los tratamientos que ofrecen a las personas enfermas. Los hospitales que ayudan a los pobres reciben menos dinero de las compañías de seguros que el dinero que se paga a los hospitales que ayudan a la gente rica. Los manifestantes quieren que la gente se informe de un otro tipo de sistema de salud que se llama Pagador Unico, que podría solucionar este gran problema.
The amount of reimbursement they get is less than hospitals that serve people in rich neighborhoods. Single payer would provide the same financial stream, the same reimbursement for care, for all people, all hospitals, all clinics, all doctors, equally.
Si los manifestantes son capaces de mantener abierto el hospital en Wyckoff Heights, todavía tenemos que cambiar el sistema que permite a los políticos como el Blumbito y el gobernador Andrew Cuomo a tratar de cerrar nuestros hospitales y que todavía permite que las compañías de seguros hacen diferentes pagos a los hospitales que ayudan la gente pobre y la gente rica.
People, not profits. Healthcare for all. People, not profits. Healthcare for all. People, not profits. Healthcare for all.
Si no cambiamos este sistema, la posibilidad que los hospitales pueden cerrar siempre existirá.